All right, good afternoon, everybody. Welcome to committee. I'm not sure that I did this intentionally, but the first announcement I'm gonna make is we're gonna shuffle the order today. So I know on the agenda, Francie had listed KDADS, DCF, and KDHE. We're gonna start with DCF today, KDHE. I doubt we'll get to KDADS this afternoon. If not, we're gonna do that one tomorrow. So I have intentionally got 2 days for KDADS. So if you're here for KDADS and you want time back, Charday already left. See you, Larry Ann. Only one. Only one. I am serious. I am serious. Okay, so that's going to be kind of the batting order. And then for the rest of the week, we will do KDADS tomorrow, and then we've got the Office of Early Childhood. We will follow that with recommendations the next day. And we also have Janet Stanek, who's here. I think she's coming Wednesday to talk about Rural Health Transformation Program. So we have pretty full days the first 3 days of the week. So with that, what I thought I would do is, this is enough to give me a little bit of time. Amanda, is there anything you want that you could kind of recenter us on where we left the budget? I don't know if you have anything handy. I should have probably not sprung this on you as well either. And while you're doing that, I'm going to go back to my budget notes. All right, thank you.
I don't have a document that I'm going to reference, but we'll go through kind of where we're at. So in the DCF's agency request, they did come asking for some funding in the current year. They wanted funding projects to reduce the SNAP payment error rate. They had some funding requests to address the SNAP ENT caseload. They wanted to terminate their employment verification services contract. They wanted funding for increases in the indices, and then also their Amazon Connect contract. They had also asked for their reappropriations to be restored because those did get lapsed, and they talked about how those were going to be used for the first year CWIS contracts. And then, of course, we also went through some of the stuff that was in the governor's recommendation, which includes a lot of those items, just at more refined amounts or different amounts. Also in the current year, the governor's recommendation had some specific upgrades for the key system, and then also some funding for some community partners to address foster care in Sedgwick County. And so that was all in the current year. And then when we go to the budget year, the agency had a lot of the same requests for 27. There was a couple of different ones. Obviously, the big one on everyone's mind is that 12.1 million. So again, that's a change that's coming down from the federal government that Kansas is more or less required to pay. And so instead of having 12.1 million in federal funds to help with administering SNAP, they need the SGF for that. They had also asked the same items as in the current year, but then they also asked about the nurse co-responder partnership program. And then again, in the governor's budget, there was some tweaks to the numbers on the various items, but all of the main ones were included. She also did the money for the foster care, stabilizing foster care in Wichita. And then also in 27 is going to be the deletion of funds and FTE related to Kansas Office of Early Childhood transition. And so again, we've kind of talked about how should the committee choose to go ahead and make recommendations on that, they can, but they can also wait until it sounds like tomorrow or Wednesday when we hear from my colleague Jennifer Light, who's going to give kind of the overall budget summary for Office of Early Childhood. And so the committee could choose then to go ahead and delete the money out of KDHE and DCF. I think that's it.
Okay, so I am looking at this yellow sheet. This is the summary of FY26 and 27. Is that correct?
So that yellow sheet that the chair is referencing, I believe, is going to be just what's in the governor's budget. The changes from what the special committee on state budget passed, and then the governor's budget. So that should touch everything, though, I think.
Okay, so with that committee, I am going to, I guess, open the recommendation portion of this on DCF. So, committee, any thoughts or suggestions? Representative Carpenter?
You snooze, you lose, guys. You may not even have a chance to talk the rest of the meeting. No, I'm just kidding. Mr. Chairman, I would like to, actually, there's two that I would like that are on page 14 of the KDAD's budget and on DCF. Sorry. And so they're big brothers, big sisters. And last year it was $300,000 in TANF. And I would like to raise that to $1 million and keep it in TANF. And what I will tell you is that there was $5 million more in TANF this year than there have been in the past. So, no, there's $5 million more in TANF. But I would raise that Big Brothers Big Sisters to $1 million, and it would come out of TANF.
Okay, just for clarification, is that for FY27?
Yes. One time.
Okay, so the recommendation is one time. Raise it to $1 million. Do I have a second for Representative King? All those in favor?
Aye.
Should have said all discussion, but we're past that part, I guess. All right. Recommendation passes. Just for a process question, is there anything, I'm gonna back up to FY26 to see if there's any actions we need to take as a committee because I will be presenting both years, FY26 and 27, in appropriations next Monday. So if I can, I'm going to direct us back there really quick. I would like to see if there's anything that the special budget committee or the governor recommended that we may or may not want to act on. Otherwise, the starting point would be what the special budget committee presented. That's kind of the handoff to us. Right. So all reappropriations have been lapsed. Okay.
Mr. Chairman, so
Carpenter?
I usually try to resist anything in 2026 by the time we get out of here. There's only going to be a couple of 3 months left in 2026, so I don't see any reason to do anything in 2026 because it's not going to have any effect.
Any other discussion? Okay, Representative Reese?
I was looking at the yellow sheet, the governor's recommendations. Number 7 is the stabilizing for foster care. And she added 436,482 in SGF for FY26 for the rest of FY26.
Okay, committee thoughts on that? I do see that. Stabilizing foster care. Did the special budget committee, it's on this sheet. Here's another copy of it. I think that one's for 26 and one's for 27.
I just,
Reese?
yeah, because just the recent finding out that how many kids are from Sedgwick County are in foster care, I think we need to jump on it just as quickly as we can. And I think this would help us to not just study, but really, find out where all the services need to be concentrated.
I'm going to interject here with just an observation from appropriations today, and I think Representative Ballard and Carpenter can offer maybe their own opinion. We've got, 4 months left, 5 months left, 4 months left of this fiscal year. Using Department of Agriculture as an example this morning, when there were instances of, say, current year funding, in many of those instances, they would take a third or what was left for the balance of the year. So I'm not sure if this was a 400,000 for 12 months. It says this would be partial year funding. Any thoughts to that school of thought or any additional thinking?
Mr. Chairman,
Representative Carpenter.
again, I resist 2026. By the time we get the budget approved, and at best case scenario, it would be 2 months left in this year, and that would be May and June, with the fiscal year ending in July, well, ending June 31st. So it's just a little bit late to get money anywhere in 2026.
Representative Reese.
And one more counter. I'm going to counter that with, one of the reasons that they're asking for this funding and knowing that it's a partial year is that they're wanting to add 4 therapists to Ember Hope. And it takes a while to recruit, train, therapists, and not to train them in to be a therapist or to be the specialized therapist that they need them to be, but, whatever, Ember Hope, whatever their training is, onboarding, kind of thing. I just think that this would give them, opportunity to start, looking for those 4 therapists.
I do think we have a request from Member Hope for FY '27. Representative King, were you going to add something?
Yes, Mr. Chair. So along these lines, I would have a motion for fiscal year '27, if now is the time to do that and at least get that solidified.
So before you do, let me just, I'm going to look around the room. Representative Carpenter has kind of proposed a path forward with 26. I'll step back and I'll step out of the chair and just offer my personal opinion. I know his thinking will help in appropriations. I don't know, Representative Ballard, if you have an opinion.
I do. I know what he's saying because they often look at the amount. But with those 2 months, though, we have done before where we don't give the total amount that's been allocated. We just look at that in terms of maybe what 2 months would be worth, okay? And I'd have to ask you again. I'm not holding my DCF folder here, so I can't look at it. So would you tell me, what did the governor give me, please?
It's 436,000.
So it's 400. But normally when we do that, we do a 50% on there. So if we want to look at what we're saying, we finished basically, so it's April, so it's May and it's June. June 30th, we go into the new year. I would then, if we want to do what we have done in appropriations that perhaps I can defend, I would say 200,000 for those terms, in case you need to run a search.
It's more than the 4,000. It's 872,964 SGF for FY 2027 to allow DCF to contract with community partners. So that is in their,
For 2 months, yes.
oh, yeah, you're right. I was looking at the wrong year.
Okay.
Yeah.
That's what I was saying.
Yeah, so it's 436, and in 27, it's 872,000.
That, Mr. Chairman, that's what, well, she has a motion on the floor, but I mean, we can even.
Have a recommendation on the floor. Do I have a second? And I guess I would say any consideration to the alternative proposed by Representative Ballard?
Yes.
I have a recommendation for 200,000. Is that what I heard?
Whatever half is.
That would be 218.
218. Do I have a second? If I need that, okay. Any further discussion? Okay. Representative Ballard?
It's her motion, but I'll close on it. The reason why I do that is he mentioned that we do look at what the budget would be and how much money is spent. But if you wait until you get into 2007, then you really can't go through the hiring the position, training the people, or anything else. This way would just allow you to get a head start on it, get them ready for it, but you're not using all that money that we're really concerned about.
Yeah. And I would say this, I do think there is wisdom. So I'll give you my wisdom in a minute. So I have a motion and a second. All those in favor of the recommendation? Say aye. Okay, opposed? Okay, okay. Recommendation passes. Okay. I will back up and say there is wisdom in both what I think Representative Carpenter and Ballard has said. Just thinking through the appropriations process, we are close. You know, we're more than halfway through the fiscal year. I know there's a lot of requests that people have been approached with for FY27. So, and there is an expectation that all committees are being as fiscally responsible as possible. So maybe a little bit of strategy with that. Okay. So I'm going to stop then on 26. Or am I ready to move on to 27? Is that looking around the room? Okay. Now let's move to FY27. Let me, give me one moment to find my budget notes and we'll go from there. Okay, again, so the starting point is the starting point from the Special Budget Committee was, what number?
Lapsing all in.
Yeah, okay. Okay. All right. Committee, so do I have recommendations for FY27 for DCF? Two hands up. I will start with Representative Oropeza.
Okay, thank you, Mr. Chair. I would recommend that we do the SNAP administrative match of 12 million.
Okay, committee, this is probably going to be a big discussion point. Do I have a second or thoughts? A second? Okay, discussion. And so I guess while you've proposed that, so whether that's Amanda, can you give us the full impact of that?
So yes, so what the representative is asking is that we go ahead and add the 12.1 million state general fund to help administer the SNAP program. One question I would have is if you're wanting that to be an ongoing expense and you are the committee, it is the committee's will to continue funding SNAP at the 75-25% split with the feds, or is this an item that you're only wanting to recommend for fiscal year 27 because you want to wait and see how the world plays out? That would be one thing. I think the committee did receive, DCF sent out a table that broke down what that 12.1 million was going to be used for. So that would be something to consider, but yeah.
Okay, then I'll clarify my motion. I'm okay waiting for, we'll do 2027 and kind of see how the world how this works out, because this is all from HR 1. So I'm okay in doing it from that perspective.
Okay, so are you withdrawing that recommendation?
So let me clarify my recommendation. My 12.1 million for 2027 as a one-time, and then we'll see how, if things are changing with the states from a federal level on down.
Okay, so I have a recommendation. Do I have a second or discussion? I have a second from Representative Reese. Discussion, Representative Carpenter?
Thank you, Mr. Chair. Does that, a question to the maker of the motion, does that include the employees then? Is that, what was it, 22 or 32 employees? Yeah.
My thought process was to include the employees.
Mr. Chair, committee, I just resist this. Two things. One is that's a lot of money, 30-some employees that I'm not sure we need. We're trying to control the budget. There's a lot of, I think, more important things out there to fund that really make a difference in people's lives. I might point to the department's own admission that since this went into effect, they've reduced the error rate on SNAP down to 5.5 with existing resources. I'm not sure we need $12 million to reduce it even farther when they've got it at least down that far with existing resources. So I will be opposing this motion. Thank you.
Any additional discussion? So we have a recommendation, Representative Reese?
Just, that this is this was imposed by the HR 1 bill. And, the piece that I guess we're not totally used to having is the employment piece. And so that's also going to involve some coaching for that. So, I hear what Representative Carpenter is saying about the 32 people. I don't know how, because it's such new territory, I don't know if they really need that many employees. But the way the way the funds are going to be used, the employee piece is not even on here at all. The breakdown for the salary, travel expenses, maintenance, IT maintenance and development, regional administrative salaries and operating costs, central office program administration, agency indirect costs allocated to cost allocation, eligibility determination and EBT contracts. There's going to be a lot of administrative costs. I don't know if, they're going to really need 32 staff, but the funding is needed. The 12 million is needed,
I think
regardless of the salaries.
Amanda has some clarification.
Thank you, Chair. Representative Orpeza, can I clarify some things with your motion? Great.
Please.
Okay. So when you're talking about the 12.1 million that you'd like to add, you are referencing just the administrative match portion. So this is only to replace federal funds with SGF. This is not the FT. This is not the payment error rate. Is that correct?
Yes,
For clarification?
I'm sorry. Yes,
Okay.
that's correct. I'm sorry. I do apologize.
Okay. I think the committee might have gotten a little tangled up in a few of the different SNAP requests. There's several. I think that the representative is referring to just the admin match piece. She is not referring to any of the increased FTE projects or caseload increases related to the payment error rate or to the employment and training program, just the administrative match. Is that correct?
Yes.
Thank you for
Yes, Amanda,
clarifying.
thank you. And I apologize to the group. Yes, it was just strictly for the administrative match.
Okay, so Representative Wilcott, pardon me.
Thank you, Mr. Chair. Is this I remember going back through, I have some notes here when we were going through the budget. I think this 12 million was going to ultimately end up, and this is a question, not a statement, this was going to end up taking the administrative cost to $66 million a year roughly for that SNAP benefits. Is that part of that 66 million total?
I recall that discussion, and Amanda's shaking her head yes.
So and I remember this for discussion, and I'm just going to throw it out there. I think the total SNAP benefits was like 427 million a year roughly. And if we add this 12 million to it to take it to 66 million, from a business standpoint, when I look at administrative costs, that comes to like 16 cents to the dollar that we're going to have for administrative. Is that correct?
I think your math is probably pretty close.
Okay, I'm just looking to clarify. Thank
Okay,
you.
committee, any additional discussion? Okay, we have a recommendation for the administrative match. All those in favor say aye. Aye. Opposed? The noes appear to have it. The noes do have it. Recommendation fails. Okay, committee, let's keep back on 2027. Any additional recommendations? Representative King?
Thank you, Mr. Chair. I would like to recommend 500,000 SGF to expand the Parenting Support Prevention, PCP, program capacity in Sedgwick County.
Okay, I have a recommendation. Do I have a second from Representative Rivas? Any discussion? Representative Ballard?
Thank you. Would you explain more, if when we're talking about that kind of money, could I have an explanation of what it does and why you want it?
Sure. This is the foster care program in the Sedgwick County, which has the biggest need.
This is Foster Adopt Connect, is that correct?
Yes, it is.
Foster Adopt Connect.
Yeah. And the goal is to prevent 188 youth from entering the foster care. So, yeah, and it was the Foster.Connect presentation that we had. And I have some like, one time fiscal year 27. Thank you. Yeah, one time.
We have a recommendation and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed? Recommendation passes. All right, keep going through. Do I have any additional recommendations? And Amanda, while I'm looking at this, I want to make sure. Representative Steens?
Thank you, Chair. Yes, I would like to make a recommendation for a proviso for the Child Welfare Workforce Initiative for fiscal year 2027 and add $800,000 from the State General Fund to the Children's Alliance of Kansas to fund the Child Welfare Work Initiative. And this would be an ongoing request.
Okay, so I am tracking with this one.
You want me to?
No, this, I'm just looking at,
Yeah.
this was on the spreadsheet that Amanda created for the committee. And you said it was ongoing? Okay. This was, yeah, I think Amanda has a copy.
Here.
Okay, so I have a recommendation from Representative Steens. Do I have a second? Second from Representative Reese. And this is in support, and I can't remember the acronym CWIS. I know the Navy term for CWIS, but not, I know, CCWIS. No, but it's, if I look at this for Children's Alliance, support DCF CCWIS ongoing. Right. Okay, we are tracking. Right. Okay, I see a lot of people looking, searching, studying. Committee, do I have any? Representative Carpenter.
Thank you, Mr. Chair. So for several years, I think it's 3 or 4 years, we've been funding the Hope Ranch, which is an organization that does trafficked women down in Andover, Kansas. Last year's appropriations of $200,000 was part of the 1.5% lapse in funding for DCF. And I'm going to ask for that to be reinstated at $200,000 one-time money.
Representative Carpenter, hold on to that one. We still haven't voted on.
Oh, sorry. Did you ask for?
I was asking for additional input on. Okay, if there's no further discussion on Children's Alliance of Kansas, committee, all those in favor say aye.
Aye.
Opposed? Okay, Children's Alliance of Kansas recommendation passes. Now, Representative Carpenter, you were making another recommendation?
What I said, yeah. Hope Ranch
Ranch.
for $200,000. We've been funding it. It was part of the 1.5% lapse of DCF's funding last year. And no, I'm just asking you for going forward. One-time money in 27.
Okay, committee, so I have a recommendation to fund Hope Ranch, $200,000 for FY 27 one time. Do I have a second? Representative Steens, any discussion? Representative Reese.
How long have we been funding them?
4 or 5 years.
5 years now?
Yeah,
I always thought it was a one-time every time.
it is. But, and I'm fine with that because we have to come back and justify it, look at it. You know, there's nothing wrong with one-time money. And taking a look at that, a lot of times the one-time money doesn't go away. Well, as a matter of fact, Envision is not in here this year. They didn't come back and ask for any money. That was one-time money. And so
Representative Reese.
I would vote in favor of it, but I would like for them to come next year to give us a overview of, yeah, because they've been expanding their program. I'd like to hear more about it.
Okay.
Thank you.
All right. Okay, so committee, I have a motion, a second, to have some discussion. All those in favor say aye.
Aye.
Opposed? Recommendation passes. Keep going down. Do I have any further recommendations? Representative Reese?
I would like to fund, it's a project, well, it's a partnership, the Nurse Co-Responder Partnership, in the amount of $500,000. It's less than what they're asking for, to begin a Nurse Co-Responder Partnership with Child Protective Services responds to a home with a child under the age of 1. And this was on the DCF budget on page 16.
All right, let me find that.
It's on the last page.
Okay, I have a recommendation. So again, it's, not putting words in your mouth, but you are recommending that this committee funds number 9, the Nurse Co-Responder Partnership, $996,000 ongoing. Agency would use the funding to request a proposal RFP for 12 public health nurses across state. Does everybody have this? I just want to make sure everybody is reading and understanding what this one is.
I'm asking for 500,000.
Oh. Okay. Representative Reese's recommendation is 500,000. Representative King.
Yeah, explain to me, would this be for FTEs? Would this be for, would it go to a third party? Or would agency resources use this?
As I read this, it says the agency would request funding, the funding would funding to issue a request for proposal to contract with 12 public health nurses across the state. The state agency reported in FY25 there were approximately 3,000 intakes assigned, which included children ages 0 to 1.
My understanding is the nurses would not, they're public health nurses, so they're not new employees, in other words, new FTEs.
Representative King.
So this is additional work that no one is doing now, or would we reduce the agency budget and outsource what they're currently doing?
The way I read it is they're not doing it. This would increase the agency budget and it would add headcount. Okay, any further discussion? Okay, committee, you've heard the motion. All those in favor say aye. Aye. Opposed? Chairman is in doubt. Okay, all those in favor, raise your hand. All those opposed? I didn't see how you voted. Okay, you in favor? Motion passes. Clarification on that, Representative, your recommendation said that was ongoing, is that correct? Or is it one time to get it started?
It's a one time to get started.
Okay, one time.
It's not say ongoing.
Okay. Okay, committee, let's keep going. Do I have additional recommendations? Representative Carpenter.
Thank you, Mr. Chair. I think this is my last one on this. This would be for the Cerebral Palsy Research Foundation of Kansas, the $215,000 that we put in last year for a pilot project. If you remember, that was the apartments for the disabled folks back behind there to get them started and living there and trying to live on their own and all that, if you remember that testimony, for 2027.
Committee, I have a motion, or have a motion, have a second by Representative Ballard. Committee, any further discussion? Okay, all those in favor say aye. Aye. Opposed? Recommendation passes. As I'm checking through the summary sheet from Amanda from the public testimony, have we already covered Big Brothers Big Sisters? Yes. Okay, that's checked. Okay. Have we covered Youth Corps Ministries? Okay. Representative Carpenter?
Thank you, Mr. Chair. I would make a motion we approve the grant, one-time money for 2027 for Youth Corps Ministries. And if you remember from the testimony, they do an incredible job with poverty and mentoring folks. And this would allow them, last year they had $350,000. This is another $150,000. And will enable them, the way I remember it from the testimony, they would be able to expand into 4 or 5 more counties, if I wasn't that the way the testimony was. Do an incredible job, and they have a great track record of raising people out of poverty.
Okay, committee, have that motion. Do I have a second?
Clarification on the amount. Is it 350 or 500?
It's 500,000.
Any further discussion? Committee, all those in, Representative Steens? Oh, okay. I thought Representative Ballard had, but I will say Representative, okay. If there's no further discussion, all those in favor, say aye. Aye. Opposed? Okay, recommendation passes. Okay. Don't know that I've exhausted all the notes that Amanda's provided me and all the budget looks.
There's a few more here.
Representative Ballard?
I would like to propose the 376,000 out of TANF for JAG-K. For the JAG-K program, and for those that are not familiar, that is the one that we have in multiple districts around the state. They could be kids that were in trouble, couldn't make it in high school or whatever. But the important part about it is that they have over a 90% graduation rate, which is the best you can have really pretty much in the state. And they would like to be able to expand from TANF funding. And they would like to be able to expand into more school districts. In fact, they will be here on the 18th of February, being recognized as they are yearly with their students. And they are doing an outstanding job in terms of educating those children that have difficulties in regular schools. And I will propose that.
I have a recommendation from Representative Ballard to fund JAG-K. Do I have a second? Representative Oropeza. Any further discussion? One time. Committee, all those in favor say aye.
Aye.
Opposed? Recommendation passes. I'm going to keep 2027 open for DCF for a moment. Are there any additional recommendations? Okay, if not, I'm going to close recommendations on DCF for today. And again, I'm going to restate kind of how I kicked this off at the beginning of the committee meeting. After the smoke settles and the dust settles from tonight, I'm going to go back and go through all of my notes and allow you to do the same thing. And if we've missed anything, and if there's a need, we can perhaps revisit recommendations tomorrow. But for now, I'm going to consider the recommendations on DCF and closed for the moment. And if you give me a moment, I'm going to then collect my stuff and work to get KDHE ready. So stand by.
Right. Ask you a question here. Did you notice this? We have two cerebral palsies, that and that. Are they the same? They're the same, okay, okay.
All of the oral testimony,
Oh.
public testimony.
Thank you. Yes, yes, yes.
Okay, committee, as we're getting ready to, as we're getting ready to roll into KDHE, Jenna just reminded me that I'm not going to do it today. We'll do it tomorrow to pass out DCF as amended. But again, I want to go back and reserve the right to check through my folders back there and go from there. Okay. So if we can, Amanda, can we do kind of the quick budget recap on KDHE?
Alrighty. So similar thing happened with KDHE. So we started from a point where the Special Committee on State Budget, in the current year, they had lapsed, it's about 19 million in state general fund and CIF reappropriations. And then they also lapsed the supplemental requests, which were for some storage charges that OITS was giving them for their cloud storage, and then also the Office of Vital Statistics relocation. The governor, her budget did restore those reappropriations in the full amount, and then I should have done this with DCF, and I apologize, I didn't. But on the Senate side, their subcommittee, policy committee went ahead and passed out. They restored about 17.7 million of the reappropriations. They went through a list. It was in KDHE's testimony, I think, for this committee as well. and just chose certain ones that they were restoring. That's in the current year. In the budget year, so same thing, we're starting from a place where we had backed out some one-time enhancements, or one-time adjustments, sorry. And then the Special Committee on State Budget didn't recommend any of the enhancement requests. And there were several items there. The big one was obviously the money for Children's Health Insurance Program for CHIP. I think the agency originally came, when they submitted their budget in September of last year, they said 26 million state general fund. I think, no idea on intent, but the governor's budget included, I want to say it was 15 million state general fund plus the associated federal funds. And then the governor's budget did include some funding for the adult inpatient behavioral health services. So this was something that's has been in the budget bill for a few years now. And it was typically 10 million state general fund. It was for select hospitals that provide inpatient behavioral health services. And it lists it in the proviso. And so her budget, instead of giving the 10 million, gives the 5 million for that piece. There was a few items related to CMS final rules and needing to implement changes through Gainwell to implement those final rules, some tech things. There was all of the items, again, with the Office of Early Childhood transition, which you're going to hear about tomorrow. So there'll be some deletion of funds for KDHE. You'll also hear about tomorrow, but also fair to mention again, is that in KDHE's budget, you've got a few different items. The smoking prevention grants, the SIDS network grant. I want to say there's one more. Oh, the infants and toddler program. Those were some pieces that were funded by the Children's Initiative Fund. That balance is running low, and so KDHE and the governor's budget are talking about how they want to use either SGF or direct key fund money to fund those. I think that covers it.
Okay. With that, I will open the recommendations for Kansas Department of Health and Environment. Any recommendations or comments to start? Representative Carpenter.
Thank you, Mr. Chairman. I just need some clarification on the KDHE budget. There was $11.8 million SGF attributed to FMAP assistance, that savings that must be spent on initiatives approved by the Center of Medicare and Medical Services. I was thinking that was near 40 million, but this is 11.8. But we lose this if we don't spend it. Is that accurate? Well, then I would make a motion that we reappropriate that 11.8 million back into KDHE's budget so we don't lose it.
Okay, committee, that figure was on the documents that we received on January 26th. It was Fund Budget Unit Type 1000-0449, Special Enhanced FMAP, 11,786,554. Do I have a second on that? Second from Representative Reese. Any discussion? All those in favor say aye.
Aye.
Opposed? Okay. And while we're doing that, just pardon me for a second. I'm reading the rest of this page here on lapsed reappropriated funds from FY 2026. Not any secrecy up here. I'm just looking at the other ones that the Senate Budget Committee recommended. Representative Oropesa.
Thank you, Mr. Chair. I would like to recommend that we reappropriate the Child's Health Insurance Program, CHIP, for $1,500, yeah. $689. Yes, please. Oh, okay, sure. Thank you. I'm getting help. Call for a friend. Appreciate that. Okay, so I want to restore the reappropriations that the Senate had cut, including the public health, early childhood data management system, the breast cancer screening program, the tobacco cessation program. Okay. PKU treatment, child abuse review and evaluation program, pregnancy maintenance initiative, the Children's Health Insurance Program, CHIP, and the State Trauma Fund. And they also did the aid to the local units.
All right, I have that list of recommendations. So finally done by Representative Oropesa. Do I have a second? Discussion? Okay, again, what we just did there is consistent with what the Senate Budget Committee and KDHE did. So any further discussion? Representative Steens.
Thank you, Mr. Chair. Yeah, can you clarify, so you said the Senate cut all that out? Okay, I think I'm misunderstanding.
Senate restored.
They restored
The
it,
Special Budget
okay.
Committee deleted. When the Senate reviewed this, these were the items that they said, no, these are necessary.
Okay, thank you.
Representative Rivas.
These are the ones in bold, basically, on the one.
Yes.
Okay.
That's correct. Okay. Any further discussion? Okay.
Close my motion.
I don't know that you have to close up. We're having further discussion. I'm just going to say, all those in favor say aye.
Aye.
Opposed? Okay, recommendations pass. Okay, as we keep working through this, I know everybody has a copy of what Amanda, or at least has access to a copy of the things that Amanda emailed to the committee. So I'm going to start looking at this and do I have any recommendations or discussions off this list? I'm going to go with Representative Steens.
Thank you, Mr. Chair. Yes, I have a recommendation of $800,000 SGF for the Mental Health Consultation and Resource Network. That's for the psychiatric mental health programs for children and pregnant and postpartum women.
Okay, I have a recommendation. I have a second from Representative Oropesa. Any further discussion? And I'm going to just confer with Amanda here. That would have been number 4. Yep, okay. Okay, I have a motion and a second. Any discussion? Okay, all those in favor say aye.
Aye.
Opposed? Recommendation passed. Committee, additional recommendations. Representative Carpenter.
And just for clarification, I don't think this was included in that represented, but was the mental health beds for the state hospitals included in that? I didn't think it was. I just wanted to make sure. So I would make a motion, we approve, do $10 million SGF for the hospitals providing inpatient behavioral health services for adults in 2027. And for many of you, we've been doing this for a number of years to help these folks that are, these hospitals that are housing our mental folks, and this would be reimbursing for that. So that's my motion.
Oh, no, I was going to say second. She got me. She's fast.
Okay, I have a recommendation and a second. Seeing no further discussion, all those in favor say aye.
Aye.
Opposed? Recommendation passes. Committee, additional recommendations. Representative Oropesa.
Thank you, Mr. Chair. I request that we do 700,000, oh shoot, I believe this is a one-time distribution for WIJO care for uninsured persons in the state, sorry.
Project Access
Project Access account
for the KC Metro,
for the KC Metro area for fiscal year 2027.
and it also has Wichita and Health.
Wichita, Topeka, and Wyandotte County,
right.
Johnson County.
So I have a recommendation from Representative Oropesa. Do I have a second? Representative Steens, discussion? Seeing none, all those in favor say aye.
Aye.
Recommendation passes. Committee, further or additional recommendations? Representative Rivas.
Are you ready for the dental ones?
We knew they were coming. He did use the plural.
There's more than one tooth. So I'd like to make a recommendation for the Medicaid dental funding for 12 million. We asked for 16 million last year and got 4. If we could get to 12, we could probably leave you alone for a few years.
That's a dental rate increase. I have a recommendation. Do I have a second? A second from Representative Ballard. Okay, so the recommendation is 12 million SGF to finish the Medicaid dental rate increase. Do I have discussion?
I would just point out that with the advances Oral Health Kansas is doing with getting more providers signed up, and the interest is going up, and I think it's a chance to maybe get over that tipping point.
Okay. Okay, Representative Carpenter.
Thank you, Mr. Chair. I would make a substitute motion to do it for 6 million.
Through the chair, is this going to be an auction? I'll call you at 8.
I'm just
I know appropriations is going to have.
reading the room when it comes to our Appropriations Committee, and that is, even us champions of spending money, that's a big lift.
Do you feel like 6 can get through it?
I think we'll do our damnedest to try.
We'll go with 6.
I have a substitute motion and a second, I'm assuming, from Representative Rivas. Any further discussion? Okay, all those in favor say aye.
Aye.
Opposed? Recommendation passes. So since that was plural, is there another one? Representative Rivas.
Well, the one we passed last year that went all the way to the governor, I would like to put in for Dental Lifeline Network funding for, it's currently being funded at $70,000. I'd like to add $55,000, just like last year, to bring it to $125,000.
I know that's on here. Yeah, it was.
Yeah, Dental Lifeline. It's the donated dental program. Dental Lifeline.
Okay,
It was recommended by Kevin was KDA
Okay,
recommended.
all right. Okay, so I have a recommendation. I'm not sure, did you get it, Amanda? Yeah. Okay, can you? Oh. Okay, yeah, so increase funding for donated dental services from $70,000 to $125,000 through Dental Lifeline. It's just that portion of number 10. Okay, so I have a recommendation, and did I have a second? Second by Representative Reese. Any discussion? Anything to add to that, Representative Rivas?
All I know is that that's really seed money that turns into several $100,000 in donated care. So it catches the people that really do fall right between those cracks of being able to sign up for benefits and the working poor, so to speak.
Okay, so I have a recommendation and a second. Seeing no further discussion, all those in favor? Clarification, ongoing or one time?
I would love this to be ongoing. We've been funding it at the other level for several years.
Okay. Recommendation is ongoing. Any discussion? All those in favor say aye.
Aye.
Opposed? Recommendation passes. Representative Reese?
Looking at that same page, it's number 17, the Communicare Network, asking for 12 million. It's an additional 12 million for the community-based primary care clinic. They're going to be seeing an increase of folks who are have no insurance or underinsured. These are lifelines in our communities, and they provide a lot of health care for people who need it, who don't have the funding, or folks who are underinsured. And we're going to see an increase of that just because just the way the economy is right now. So I make a motion to I'm asking for an additional 12 million for the community care network.
Okay, I have a recommendation. Do I have a second? Representative Ballard? Representative Ballard?
I will second it for discussion. But when you say 12 million, it's a beautiful number, but we have to defend it. Give me some more stuff that we can help defend with, maybe.
I can give you tons of paperwork on
See when we discuss it.
are you offering a different motion, different amount?
He will.
Representative-
I will pass.
Okay, Representative Carpenter.
Thank you, Mr. Chair. So Amanda, could you remind me how much that we already fund them at annually? I think it's around 20 million, if I'm not mistaken.
I think it's 18.
18 million, so that would bring our total to 30 million. I'm going to make a substitute motion to half that, and that's a gift.
With a bow on it, I love it.
I take the substitute motion is with a second from Representative Reese?
Yes.
Okay. Okay, that's Community Care Network. They do good work.
And I believe 100% that they do great work, and if we weren't up against budget constraints, we wouldn't be having this conversation.
Okay, so I have a substitute motion, a second. Any further discussion? Any all those in favor say aye.
Aye.
Recommendation passes. Additional recommendations. Representative Wilcott.
Thank you, Mr. Chair. I have a question with my request, or I'll open for discussion. The Pulsera, the 2.69 million that Pulsera brought and presented, I love the idea of bringing technology and looking to make those investments. Is there a chance we can make it contingent on spending it through the Rural Health Transformation Program, as that's a one-time kind of a technology investment?
I don't know that we can make it contingent, but I do know that that is something that KDHE is interested in, that EMS technology. I see heads shaking back there. I'm not sure what the exact prospects were if Representative Amanda. Yeah, so what Amanda recommended is you could say something to the effect, using the RHTP funding if available. If not, it would be SGF. Or not fund. So are you making a recommendation?
Yeah, I'll make a recommendation for the 2.69 million, with the proposal to go to the RHTP, and if that fails, to then have it go to SGF for one-time spend.
Okay, I have a recommendation. Do I have a second? Representative Oropesa? Okay, discussion. Any further discussion? Seeing none. All those in favor say aye.
Aye.
Opposed? Recommendation passes. Okay, we're back on recommendations. Okay, I'm sorry, Representative Ballard, I was conferring with,
The wheelchairs, are they under KDADS too?
They're in KDH.
They're in KDAG.
so are you referring to
I'm looking for it on this.
item
list.
number 2?
Like item 2, in-cart, is that what you want? This is rural, wheelchairs, in-cart. But I don't see amount of money though.
Representative Carpenter?
I think what I was looking for was the testimony from the cerebral palsy folks about complex wheelchairs. We've dealt with that a couple of years in a row.
Yeah.
Amanda, do you find that on there? I think it was going to be a code increase, if I'm not mistaken, a reimbursement increase.
Well, it says increase in reimbursement rates for complex rehab technology.
Well, that might
Would that be it?
be it.
Yeah, Mr. Chair?
Representative Ballard?
Just to read it, if we're doing in-cart, it wants to increase reimbursement rates for complex rehab technology codes. Yeah, it's the codes, so that would be equals 100% of the prevailing Medicare rule rate. And this is for wheelchairs. I think that's the one we want. So they don't have amount, but they have increased reimbursement rates.
Let's give Amanda to, she's not tracking that one.
Mr. Chair,
Representative Wolcott? Or Representative King, I'm sorry.
so would that be an ongoing, or that be one, it would be ongoing then, right? I mean, if it's based, if it's equal to.
Reimbursement rate
Would be
would be-
ongoing. Okay. Thank you.
Okay, we have testimony, we don't have an amount.
We don't have an amount. I tried.
Let me see, I might have phoned a friend, or they're listening.
Okay.
Mr. Chair,
Representative Ballard?
while we're waiting for that, for the rest of you, in case you're wondering why we're being really particular about this, is that we're going to be asked to explain all details. Why? Is it one time? Is it ongoing? How much did they get before and everything else? So if it seems like we're asking you excessive questions, it's because if we pause and we don't know, they take. So we're trying to make sure that we have the answers so that we can keep as much in the budget as possible.
In-cart is not the wheelchair folks. That's what I was looking for.
So do we have these two then?
Yeah. Yep, that's the one.
So is your recommendation then on,
The Gila? No. Same organization, okay.
just want to make sure we're tracking the right recommendation. So we're talking about the Cerebral Palsy Research Foundation, add 263? Okay, for KDHE posture seating.
Yep.
It was added last year's one-time funding, and so the recommendation is for an additional year's funding? Okay, that's the recommendation, and we had a second from Representative Steens. Any further discussion? Okay, all those in favor say aye. Aye. Opposed? Recommendation passes. So in that spirit, was there, Representative Ballard, were you discussing number 2, the NCART for the reimbursement rates for complex rehab?
No, we were trying to figure out which one had.
Oh, okay.
Chairs.
Okay.
Because, you know, we had two, because one, the top one we did was the 215 for the
Okay.
Gila portion, and we just wanted to know which one.
Okay. Okay, committee, further recommendations. Representative Carpenter.
Thank you, Mr. Chair. We're down to, I think I saved enough money between Representative Ruiz and Representative Rivas to fund CHIPS. And my recommendation would be for $20 million for the CHIPS program. Committee, I would remind you that those are our children, our most vulnerable children, and if we're going to be responsible for them in the Medicaid world, we need to make sure that they are as healthy as possible going forward. It costs us about $200 a month for CHIPS for children, so it's a pretty reasonable program, but if we don't get ahead of these kids and get them healthy and keep them healthy when they're that young, we're just going to incur more costs in the future. So with that, that's my motion.
I have a recommendation by Representative Carpenter and a second by Representative Ballard. Any additional discussion on CHIP funding? Seeing none, committee, all those in favor say aye.
Aye.
Opposed? Recommendation passes. Okay, committee, any additional recommendations? Representative Oropeza.
I have one final, final for me, recommendation. And I'd like to see if anybody was interested in a rate increase for the CRNAs that provide for dental cases and our mobile anesthesia out here for our rural communities, spreading over about 10 counties. I know they asked for about 1,900 plus, but if there's any, I would ask for the rate they did ask for to make that comparable for them, but I'd be open to any suggestions.
Second by Representative Ballard. Discussion. Representative Carpenter?
So, Mr. Chairman, was that what we were working on earlier?
It was.
And at least at this time, and we looked for fiscal notes back from KDHE, and it was, what was it, 20 million?
It was 15 million.
15 million SGF to provide that service. And I do think it's a great service. I just don't know if we were questioning, and I haven't looked at my emails since then because we were just doing that as we came to committee, but I did send another email. Just that seems like an awful lot for, what is there, 750 folks on that? Yeah.
15 million if you just do the math. 15 million divided by that amount. Representative Rivas.
If I could offer some insight on this, so I think they misstated the fiscal impact on this substantially. So I've been working on the math on this, and I think the fiscal impact, I think 1 million will cover a ton of work. That'll cover 500 cases, okay? So, and I don't think we're going to have, so I would say if we set a fiscal impact of 2 million instead of 1,000 cases, that'd be very generous. So I think, I've got a motion written out here. I think that kind of puts us all together. If you'd like me to offer a substitute motion.
Representative Oropeza, would you mind if he read his substitute motion for discussion?
Okay, yes, that's fine.
Representative
Thank you,
Rivas?
Representative Rivas.
You can second it if you like it. So one of the problems is we need to define who's getting paid to do this job. And so in talking to Jeff and Jeremy, they were kind of helping with that definition, which I think is pretty fair. So I put that into the motion. So we define who qualifies for this and what it's for. So my motion, I sent this to Amanda as well.
Okay.
The motion is for authorization for KDHE to authorize any qualified anesthesia practice as a payor This entity is defined as a practice with over 5 years performing office-based anesthesia in Kansas, has a patient demographic population of over 50% CanCare, Medicare, D-SNP population over the previous 5 years, and serve over 10 counties in the state of Kansas. They'll be reimbursed at a case rate of $1,936.26. Physical impact, $2 million. If you want to change that to $1 million, I think we're fine.
Okay, so it's the dual eligible special need payments, patients, that's the
That's the carve-out, yep.
that's the criteria, okay, and that's for mobile or sedation dentistry. Representative Carpenter.
It's also, they do other things besides dentistry. I mean, it's mostly dentistry, but I think they do some other things as well.
Yeah, and I don't disagree. I just want to read you what and I know this is true. These are D-SNP folks, so that's a little bit different. We cannot pay for D-SNP members as Medicare is primary, and we can't pay above the Medicare rate, which is around $200. The rate, Jeff has for the rate to be just over $1,900 for all the Medicaid members they serve, which is the 15 million as it's SGF only right now until the codes are changed. Even if the feds create a new code for D-SNP members to be paid by Medicare, we will cover the copays. We will have to cover the copays if Medicare doesn't cover the new code. So I think that's where it's all SGF. In other words, there's no federal money involved in it. So it's all SGF. Okay.
Yeah, I didn't realize that.
Okay, so I'm tracking conversation. So, and you're suggesting a monetary cap?
I would have a hard time believing they're going to go over that. At $1,900 a case, you're going to have, there's only so many providers, there's only so many cases you're doing in a year. I mean, it's.
I'm not sure just that KDHE can appropriately do that with Medicare. I would say this has been a Bethel Committee topic, and I know KDHE has reached out to CMS to get a code for this, and we're waiting on that. So it might be one, if you can suggest you reach out to KDHE and just say, here's a proposal, can we do this? See if you can get a yay or a nay on that. And if there is a yay, if there's some way to do that, then we can reconsider that. It doesn't feel like we can, and especially I'm up here not muttering, but conferring with Amanda. Representative Ballard?
I would agree with that, but yes, if he can get an explanation, it makes it a lot easier for us to be able to defend it, because then all they'll come back and say, you can't do it. But if they say we can, they need to tell us how we can, because it's needed. You know,
Right.
I wouldn't really say we'll go to bat for it, as long as we know it is an area that is needed and could make a difference in the lives of quite a few people.
Will do.
Okay, committee, any further recommendations or additional recommendations? Representative Steens.
Thank you, Mr. Chair. So I just had a question on the NCART. I know you guys met in Bethel Committee, right? So when I'm reading this, I thought that they wanted to get the Medicaid rate up for reimbursement. Is that correct? Okay. Are we still working? Is it still around 60%?
Oh, the Medicaid,
The reimbursement rate right now? Okay.
62-ish or so?
62-ish, okay.
63.
And sorry, I didn't watch your committee. Was there discussion on that? I'm just curious, because I know a lot of our Medicaid providers that do the wheelchairs were saying that they barely break even. So I don't know if there was any discussion on that. Thank you.
There was discussion, and for the life of me, I don't have immediate recall. I looked at Representative Carpenter Ballard, if you remember from most recent or previous Bethel committee meetings on this topic.
It must have been late in the day because I quite frankly don't remember.
Amanda has found nothing.
I'm just asking because I'm sorry, I didn't mean to, just to redirect, to see if there is a possibility of raising those at all. Because I know a lot of our providers, well, I can tell you just for people that I know personally, and I know Scott Lopez has been one that's testified many times in front of your committee, they barely break even. And so it's very difficult for them to, I think he has just one branch here. Most of his are in Missouri. And then I know Gerald Sloan, another vendor from Momentum, same situation. The Medicaid rates are just so low, they barely break even. In fact, I think a lot of times they lose money on those chairs. I know many times I've heard they don't get reimbursed. So it's a very complex thing. It's not just simple. It's not like you just throw someone in a wheelchair. I mean, it's very involved. It takes a lot of assessing. It takes a lot of posturing, a lot of refitting. And I think it would be a case that could be made, even if we could bump that up some. I'm not sure a number that would work, 80% maybe. I'm just kind of shooting that out there. Thank you.
Representative Carpenter?
And I appreciate that, and that has been an issue. And I'm not opposed to it. I would just like maybe KDHE could get, if this would be something that the chair we could look at first thing tomorrow.
Sure.
For more information as far as a fiscal note. I just hesitate to jump on anything without, I mean, I don't think it's going to be in the hundreds of millions, but I just like fiscal notes. So if the representative would wait until tomorrow and KDHE is out there and Ally can whip that out for us. So, okay.
Perfect. Thank you so much.
Do that. I'm going to confer with Amanda here for a minute. Okay, committee, any further recommendations? Okay, so what I just asked Amanda to do was to take today's work and put it in the, I'm going to call it the Appropriations Committee, Budget Committee format, so we can take a look at the starting point of the agency. We can take a look at where the Special Budget Committee, what their work was. If the Senate did some work on some of this stuff, we'll see their work, and then she will have recorded what we've done today. That's going to build the snapshot going forward. So if there's additional work to do tomorrow, hopefully it's limited in light, and if whatever that entails, then we can come back and make a motion to approve the budgets. Okay, so that's kind of what I'm going to do. So now I'm going to pause there and say, are there any additional recommendations for today? Representative Carpenter.
I don't have a recommendation, just a clarification. So in the global motion that Representative Orpezo made, was the Stan Clark Pregnancy Initiative Center in there? Okay. And I thought it was, but I would feel like an idiot if it wasn't. So,
Representative Ballard, did you have anything? Okay. Okay. So committee, any other recommendations for today? Okay, with that, we're going to close the recommendations at this point. We will adjourn for today. We will pick this back up from it. What I would encourage you to do is, and I will do the same, I'm going to go through these two agencies and then also for tomorrow, KDADs, and we will start, after we pick up, we'll start there. And if there's no further business, committee, we are adjourned. Thank you.